So welcome to the latest edition of the Business Spotlight podcast. I'm joined today by Andy Richmond of the Pharma Supply Advisory. It's good to see you, Andy. Welcome to the call.
Oh, thank you, Gavin. Really looking forward to this.
So you're in a very niche sort of market that's involved in supply chain in the pharma industry. Give us a very brief summary of what it is that you do and why you do it.
Yeah, so I'm 30 years in the pharma industry nearly. GSK and Pfizer were my two main employers, and I've had roles in the UK, leadership roles in Europe, and global leadership roles. And for the last 30 years, I've been building supply chains, managing supply chains, and trying to get products to patient. That's the main aim, but always from within one company. And I've realized that actually the problems associated with supplying patients are across the supply chain, very difficult to solve from one location only. So I set up Pharma Supply Advisory to try to bring together the manufacturers, the wholesalers, the pharmacists, and ultimately the patients to provide solutions which mean more patients get more medicine more often, and also when they're on that medicine, that they use it properly, because that's the critical piece the supply chain often misses.
That sounds very much to me like if you're bringing together the best minds and you're looking for solutions. We're talking about thought leadership here, aren't we?
We are, yeah, and a very large part of that is getting on the data science bandwagon that is really accelerating. So generating new insights and understanding what to do with those insights. I think this is a point in time where supply chains are going to benefit like never before from advances in AI and data technology. I also think drug developers and prescribers, payers, will also get a lot of benefit from understanding their patient populations a lot better. So I'm really excited about trying to bring cutting edge data science into the mix, which in my 30 years of working really hasn't been a part of the way that forecasts and demand planning and things like that have been managed.
It sounds rather to me, Andy, so you're a bit of an innovator. You know, you're looking for change in your industry and to bring about change. Is that something that is, you know, why is that a barrier for many people in your industry? Why does that not happen perhaps as readily as it should?
It's a really interesting question, and I'm going to speak on a very general level now. There's huge amounts of technology used on the R&D side of the pharma spectrum. Really innovative technologies being used, but on the commercial side, still actually it's quite a manual planning and management environment. Some data is used. It's used better with some manufacturers than with others. But as OPEX has been squeezed, as the ability to invest in the business has reduced, as drug prices have come down and the like, this manual approach to forecasting demand is not really meeting the needs of the business or investors or patients at the moment. And I've been working with a group. I formed a partnership with a data science group who've done amazing things in other industry sectors. And I think the time is right now to bring that innovation into pharma and to really streamline the way that pharma visualizes its supply chains and also how it manages its patient populations.
So ultimately, this is about getting the right medicines to the right patients at the right time and in the right quantities. So it's very much a patient-focused initiative, but it's looking at the systems behind all of that. So, and although you didn't mention that, I got a hint of AI in that answer as well. I'm assuming that plays a role in evaluating, you know, where some of the innovation may come from and what it may look like.
Absolutely, and I think you've partially hit the nail on the head. So everything we do is actually focused on the patient. Yeah. The supply chain is a tool that enables that patient to be managed effectively. What I'm really interested in is ensuring the health of the supply chain. So can you get the product to the patient at the right time? But I'm also interested in how you support that patient once they've received the medication.
Right.
So there's a big debate at the moment in the UK about the role of pharmacy in the community. We know through the pandemic that pharmacy has become a trusted partner of many patient communities. GPs are increasingly difficult to access for many people, but most of us are visiting a community pharmacy regularly, once a week, once a month. A tremendous skills base in those pharmacies, and a drive towards services is occurring and is being politically pushed. But actually, at the moment, the cash isn't following that intention. So, community pharmacy at the moment is struggling to make the right sort of business model and profitability out of service provision. So things like medicine use reviews, but also general biometric testing and information around therapy areas and the like. And I think by utilizing some of these data science opportunities, first of all, you can reduce the admin associated with a pharmacy trying to identify the patient that he or she needs to speak to. But I also think you can profile patient types, patient archetypes much better, so that you can create tools that the pharmacist can use with patients to better encourage their active participation in their treatment. And that is a really interesting piece, because most medicines on average will have something like a 60% adherence associated with it, give or take a few percent, but roughly 40% of the time a patient stops taking medicine or stops taking medicine properly. And a patient can't get well if they're not taking the tablets. And there are all sorts of reasons why that happens. And I think this is one of the areas that AI and data science can really start to peel the onion a little bit, try to understand what is driving those behaviors, what other lifestyle choices are taking place. And that gives you a better opportunity to talk properly to that individual patient on a bespoke level about their issues, their barriers, their worries, their concerns, and to effectively educate them in a much more targeted way than has previously been possible. And I think that's tremendously exciting.
I've got a couple of thoughts around that I'd like to share with you, and then we can look at the opportunities arising. So just taking it out of that context, initially, when the pandemic first arrived, businesses started to change the way that they did business, working from home, using Zoom, all kinds of communications. And, people were talking about how the pandemic had changed the world. And I actually took issue with that. And my answer, my viewpoint really was what the pandemic did was accelerate change that was already happening in the world. So many of these trends had already started. And you just talked about some of the trends and challenges in the sort of the medical space, about it becoming increasingly difficult to access doctors and patients not perhaps having the education about how correctly to take their medicines, and pharmacists. So in terms of the changes that are already happening and clearly accelerating, with change comes opportunity.
Absolutely.
So what sort of opportunities, sort of working with you and your associates, would be presented to, say, pharmacists, perhaps, and doctors and other people? What kind of opportunities do you see from a commercial point of view that is patient-centered, which is obviously clearly an important part of what you do?
Yeah, I think so. The average pharmacy in England, I think, has something like a 6,000 patient population associated with it. And of course, the average pharmacy could be a family-owned pharmacy, or it could be part of, a Boots or a Lloyd's large-scale chain. But the fact is, their 6,000 patients are different than. I always use the example of, if you're in central Coventry, your 6,000 patients there look entirely different than the 6,000 patients if you're in Swansea or Portsmouth. Being able to understand your 6,000 patients, what are the demographics in your area?
Yeah.
What is the level of socioeconomic profile of your area? What's the level of education in your area? What type of disease areas are prevalent in your area?
Yeah.
Can you be predictive about what those 6,000 patients are going to walk through your door and want support with? These are all the type of things that data technology can provide. It's an ability, I think, to do micro marketing effectively and to be able to provide tools and communication messages that better inform those 6,000 or so patients that you've got in your area. Now, there's a lot more to it than that. But as a starting point, I think that's the pivot point that happened in the pandemic.
Yeah.
There's still a desire in the patient population for a face-to-face interaction. There's reassurance in that face-to-face action. People are ill and are anxious and need that human interface to be able to feel like their journey is being managed. But at the same time, there's a whole raft of things that can inform that conversation that can be done quicker, can be done on an aggregated level, bringing more data sources into the targeting process, for instance. Lifestyle triggers, all these type of things. These, you can see these in the data environment, and if you can provide that sort of visibility to your local community pharmacist, then your local community pharmacist has got a much better chance of being able to get better outcomes for the patients, and also, I think, of growing their business. Because every time a patient goes into a pharmacy, there's a very high chance that they're going to buy something else whilst they're in there. So that increase, or it might not be a natural increase in footfall, but it might be an increase in frequency of footfall, is fundamental to the pharmacist business model. So there are wins all over the place, but it's fundamentally enabled by really understanding the local population better, so that those services can be tailored to that local population.
So there sounds like there's a massive opportunities here. So if you're a business owner, if you're a pharmacist, if you're a thought leader, if you're an innovator, if you're an investor, you're in that space where you can help and direct and
absolutely.
So what's the best way to find out more about what you do, Andy, and to make contact with you?
Well, so I obviously have a webpage, pharmasupplyadvisory.com, which has got all of the contact details on there. I'm active, obviously, on LinkedIn as well. And quite a few of the innovative ideas that we're working through I post regular updates on LinkedIn. But of course, andrew.richmond@pharmasupplyadvisory.com is also a great way to get in touch.
We'll put the contact details on the video so that people can see those.
Absolutely.
And it's been a real challenge to get so much interest and such a vast topic into a very short sort of video podcast. I could speak to you for hours, and I'm really looking forward to finding out a little bit more in the future about what you do and where you're going, and what's happening in this really exciting space.
Absolutely,
Gavin.
I'd love to talk again, and I think my last thought would be, I think data science is going to have the biggest single impact on healthcare since the discovery of antibiotics in the early 20th century. It's really exciting, and anybody who's interested in the conversation about investment opportunities or thought leadership, network building, please get in touch.
Fantastic. What a brilliant note to finish on. Thank you.
Thanks, Gavin.